All right, so just clear your mind. Just listen. Frontalis, orbicularis oculi, nasalis, zygomatic major, zygomatic minor, levator labiae superioris, levator anguli oris, orbicularis oris, depressor anguli oris, depressor labiae inferior, mentalis, platysma, sternocleidomastoid, originates sternum and clavicle, inserts mastoid process, innervated by cranial nerve 11, the accessory nerve, omohyoid, sternohyoid, scalene, sternothyroid, thyrohyoid, temporalis, massive, fusiform, inferior oblique, inferior rectus, lateral rectus, cranial nerve 6, abducens, medial rectus, superior oblique, cranial nerve 4, trochlear, superior rectus, levator palpebrae superioris, cranial nerve 3, oculomotor, cranial nerve 2, optic, occipitalis, deltoid, originates clavicle, acromion, spinal scapula, inserts deltoid tuberosity. Nerves intervention, axillary nerve, pectoralis major, originates clavicle, sternum, ribs 2 through 6, inserts greater tubercle humerus, pectoralis minor, serratus anterior, intercostal, linea alba, external oblique, anterior rectus sheath, rectus abdominis, internal oblique, transverse abdominis, posterior rectus sheath, diaphragm, phrenic nerve, latissimus dorsi, trapezius, occipital bone, C7 through T12, inserts clavicle, acromion, spinal scapula, innervated by cranial nerve 11, the accessory. It's the last time for origin insertion for trapezius. Levator scapula, rhomboid minor, rhomboid major, all three innervated by dorsoscapular nerve, erector spinae, iliocostalis, longissimus, spinalis, biceps brachii, musculocutaneous nerve, coracobrachialis, brachialis, deltoid, clavicle, acromion, spinal scapula, deltoid tuberosity, last time word insertion, innervated axillary nerve, pectoralis major, clavicle, sternum, ribs 2 through 6, inserts greater tubercle humerus, last time for origin insertion. Pectoralis minor, trapezius, same origin insertion. Accessory nerve, cranial nerve 11. Latissimus dorsi, deltoid, same origin insertion. Axillary nerve. Levator scapula, rhomboid minor, rhomboid major, dorsoscapular nerve, supraspinatus, infraspinatus, teres minor, teres major, triceps brachii, radial nerve, brachioradialis, flexor carpi radialis, palmaris longus. Flexor carpi ulnaris. Median nerve. Ulnar nerve. Flexor digitorum, 1, 2, 3, 4, superficialis. Flexor digitorum, 1, 2, 3, 4, 5, profundus. Flexor pollicis longus. Median nerve. Ulnar nerve. Fingernail. Extensor carpi radialis longus. Little muscle belly. Extensor carpi radialis brevis. Big muscle belly. Extensor digitorum. Extensor digiti minimi. Extensor carpi ulnaris. Now the extensors that insert completely on the ulnar side, extensor digiti minimi and extensor carpi ulnaris, are innervated by the deep radial nerve. All the other ones, extensor digitorum, extensor carpi radialis brevis, extensor carpi radialis longus, are innervated by the radial nerve. Iliopsoas. Gracilis. Adductor longus pectinis. Adductor magnus. Adductor brevis. Obturator nerve. Sartorius. Originates anterior superior iliac spine. Inserts proximal medial tibia. Quadriceps femoris. Rectus femoris. Anterior inferior iliac spine. Patella tibial tuberosity. Vastus lateralis. Greater trochanter. Patella tibial tuberosity. Vastus intermedius, we're not doing. Vastus medialis, okay, posterior femur, patella, tibial tuberosity. All muscles in the anterior compartment of the thigh are innervated by femoral nerve. Gluteus maximus, inferior gluteal nerve. Gluteus medius, superior gluteal nerve. Gluteus minimus, superior gluteal nerve. Piriformis. Lateral side, posterior thigh, biceps femoris. Superficial, so it's long head of the biceps femoris. Ischial tuberosity, fibular head. Lateral side of the posterior thigh, biceps femoris. Deep dissection, short head of the biceps femoris. Posterior femur, fibular head. Tibial nerve. Medial side, posterior thigh, superficial dissection. The semitendinosus. Semitendinosus. I'm on top. Ischial tuberosity, proximal medial tibia. Medial side, posterior thigh, deep dissection. Semimembranosus. I'm covered by tendinosis. Proximal medial tibia. Ischial tuberosity, proximal medial tibia. Tibial nerve. Extensor digitorum longus. Extensor hallucis longus. Tibialis anterior. Deep fibular nerve. Gastrocnemius soleus. Tibial nerve. Cervical enlargement. Lumbar enlargement. Conus medullaris. Blow up of conus medullaris. Phylum terminal. Cauda equina. Dorsal root. Dorsal root ganglion. Ventral root. Spinal nerve. dorsal ramus, ventral ramus, dorsal column, dorsal white column or posterior white column, lateral white column, ventral white column or anterior white column, dorsal horn or posterior horn, lateral horn, ventral horn or anterior horn, dura mater, falx cerebri, falx cerebelli, tentorium cerebellum, brainstem, midbrain, pons, medulla oblongata, diencephalon, thalamus, hypothalamus, pituitary gland, cerebellum, central sulcus, pre-central gyrus, post-central gyrus, lateral sulcus, parieto, occipital sulcus, frontal lobe, parietal lobe, temporal lobe, occipital lobe, cranial nerve 1, olfactory, cranial nerve 2, optic, cranial nerve 3, oculomotor, cranial nerve 4, trochlear, cranial nerve 5, trigeminal, cranial nerve 6, abducens, cranial nerve 7, facial, cranial nerve 8, vestibulocochlear, cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, cranial nerve 11, we're going to use the other picture, accessory, cranial nerve 12, hypoglossal. That's that. We're going to do that at the end of every class from now to the end.